Planning and scheduling processes are really important because they obviously affect how we come to interact with every patient we see. In the past we've made kind of small changes to our appointment system, but one thing we've never really done is stood back and started afresh in looking at how we can change the way patients contact us.
It's very difficult because you don't have a lot of appointments available, particularly if that patient wants a specific doctor within a specific time scale. So we need also to look at how we can give more flexibility with the appointment system that we've got.
Anecdotally we knew there was a problem, but we didn't know really the root cause of the problem. So it's a matter of looking at all the schedules, looking at keeping information, tick sheets, number of phone calls, etc., and working from there.
The Planning and Scheduling module provides a practical, structured approach that will help your practice manage capacity to meet demand. The module is designed to work as a rotating cycle of long-term planning and review rather than a one-off process. Planning focuses on making long-term, yearly or monthly plans, such as creating rotas and contingency plans to deal with predictable areas like holidays, training, sickness, and peaks in demand like the flu season, forming the basis for your appointment system. Scheduling focuses on your short-term plans, how your appointments are allocated. This local optimization of your practice will ensure that your monthly and annual plans are achieved.
We started by gathering data from patients and staff. We have a patient group where we talk to them. We also did questionnaires for patients, got about 100-120 questionnaires completed within about 3 or 4 days.
What everybody would like when they need a doctor's appointment is to be able to ring up and get an appointment shortly afterwards or at a time convenient to themselves. And one of the regular items on our focus group agenda is the making of appointments.
Once we gathered all the data together, then it was a matter of looking at that data and working out where to go from there. So it was basically the partners, myself and some of the staff sat down together, looked at the data and said, right, well, we've got a problem here, how are we going to address it? And we came up with ideas of different ways of giving people appointments, dealing with the consultations and seeing what would work best.
Appointments, how can I help you?
My involvement in the programme was to collect information for patient access to the surgery by telephone, and the data that we collected was length of time, frequency of calls and what type of appointments were needed and whether we could offer that.
Thanks, Karen. What type of call was that, please?
So that was baby immunisations.
Yeah, that's great.
And entered it into our analysis tool to find out when our peak call times were. It really confirmed what I expected it to show with peak times and not having enough staff. But I feel that the analysis tool will be really useful in future as it will be able to pinpoint exact demand for staff at peak times. The other thing that we did was also collect a true demand sheet.
Every time we received a phone call or a request, we would mark on there what the patient wanted, whether it was an appointment on the day, whether it was an emergency, whether it was with a specific doctor.
The aim of the true demand sheet is to ask ourselves, did the patient get what they want? If not, why not? And then how we can improve that service to offer that service to the patient in future.
One of the things it involved was doing a capacity and demand analysis of our appointment system, so looking at what our patients were asking for and what we were able to deliver. Leading on from that, we found that there was a mismatch in that, which has enabled us to really start again to try and make sure we offer a different mix of appointments, particularly more telephone access.
Our systems administrator actually developed a way in which we could see a little bit clearer what capacity there was on each day. and everyone really liked it. So when we were working as a development site, it was just something that was thought that might be useful to other practices, so that was built into the programme.
So the schedule breaks down the appointments available into different categories like prescribing, teaching sessions, meetings, so that you can actually see how many patients can be seen in that day. One of the things we added was to identify what we class as red days. And red days equate to basically we haven't got the capacity for pre-bookable appointments, so that we could either reschedule doctor sessions or plan to book locums in to cover the shortfall.
We're seeing an increasing number of services where possible migrating to the internet in some form or other. People have been booking a doctor's appointment for some time now, and there's lots of evidence to suggest that where services like that are enabled, then there are big savings to be made. However, there's a big issue because 9 million adults in the UK do not and have not used the internet before. And if you were to believe what Ofcom tell us, then at least 8 million of those never will. So if we're going to really extract the benefit from a service like online appointment booking, then we really need to ensure that it covers all the digital channels that are available to us. It's no longer good enough just to deliver a service on a website accessed via a computer. At the moment we have digital television in I think around 80% of homes. We have smartphones, we have devices like the Nintendo Wii which connects to the television, which can access all kinds of online services and so on. They all offer a window into online services.
One of the areas we looked at was the nursing appointments. The ones that run the chronic disease clinics were finding that they were spending a lot of time doing basic blood appointments. I had actually talked to the phlebotomist about increasing her hours, but the phlebotomist wasn't keen on that, so she actually spent time looking at her sessions, looking at where we could save time, where we could increase appointments by moving things around, and she actually managed to create, within the time she was already working, 10 extra appointments a week, which equated to something like 18 surgery sessions a year extra within the current time. So we managed to do it no cost to the practice, and she's actually finding her workload is far better.
The planning and scheduling module has been very useful for us. In the past we've made small changes which haven't really ended up making any difference. The programme has given us the tools to do that properly, being able to objectively look at where the problems were with the system. We're able to make changes that were much more likely to succeed.
At the end of the day, if you really want to improve access for patients and improve working lives in the practice, then this is the way to go.